Hey, Miss Lafferty, how are you?
All right.
So Dr. Jones told me that he has just diagnosed you with GERD, or gastroesophageal reflux disease. Did he explain anything about that to you, or did he just send you on your way?
Just sent me on my way.
Well, how are you feeling today?
Oh, I've got some burning here. I've been coughing.
Has this been going on for a while?
Yeah, for a little bit.
Okay. Well, let's look at this board that I have here, and we'll go over it together and talk about some stuff, and maybe we can get you straightened out, okay? So gastroesophageal reflux disease, GERD, it's a digestive disorder that affects the ring of muscles between your esophagus and your stomach. It's called the LES, the lower esophageal sphincter. It's this little muscle. It goes right in between your stomach and your esophagus. And what GERD does is it allows the contents that are here in your stomach to stick back up through the esophagus, which is the burning that you feel in the back of your throat. And do you have like an acidic taste in there sometimes? Okay, so yeah, that's definitely sounds like it is. There's a lot of ways that GERD's diagnosed. He's diagnosed you based on symptoms. He wants you to also go have an EGD done. Do you know what that is?
No.
Okay, we're gonna set you an appointment up, and you'll go to the hospital. They're gonna set you up with a little bit of twilight sedation, and they're gonna put a teeny tiny little scope down your throat that's got a light and a camera on it, and they're gonna look for any kind of inflammation, irritation in your esophagus, and then you'll wake right back up. You'll go home that day. It's an outpatient procedure, no problem at all. Okay, is that all right?
Yeah.
All right, honey. So a lot of risk factors for GERD. I know I looked at your medical record before I came in. You do not have a hiatal hernia. You're not considered obese. Are you pregnant?
No.
Okay. Do you ever have gastroparesis, which is delayed emptying of the stomach? Sometimes it can make your flatulence or your belches smell really foul. Sometimes like rotten eggs. Do you ever notice that?
Yes.
Okay. Rheumatoid arthritis?
No.
Okay. What about lupus?
No.
Good. Good. So there's some modifiable choices that we can talk about that causes GERD to affect a lot of people. So let's go over those and see if you see anything that looks familiar or jumps out at you, okay? Do you smoke?
No, but I vape.
You vote? Okay. How about chocolate? Do you like to eat chocolate?
Not usually.
Okay. What about fatty foods?
Oh, yes, I love my deep fryer.
Oh, very good. Sounds good. Well, so I guess that covers fried foods also, huh? Are you a coffee drinker?
I am.
Okay. What about alcohol?
Oh, yeah, I love my White Claw.
White Claw, of course. What about eating before bed?
I do like to eat before bed sometimes. I like to eat chips when I'm watching TV in the bed.
Okay. And I saw in your medical record that you have had gastric sleeve surgery. So you know that you don't take NSAIDs anyway, right? Like aspirin or ibuprofen.
Yeah, sometimes I take ibuprofen though.
Do you know why you're not supposed to take that?
No, not really.
It can kind of erode that lining of your stomach, which will also exacerbate GERD.
Oh, okay.
So if we could knock that out, we'd be killing two birds with one stone.
Okay.
All right. Let's talk about smoking. Do you think that the vaping, do you think that's something that you could eliminate?
I might be able to cut back, but eliminate, I don't know.
All right. You said chocolate wasn't a big deal. Fatty and fried foods. The fair's coming up. Are you going to the fair?
Yes.
All right. Do me a favor. Stay away from the fried Oreos, okay?
Oh, okay.
I know they're good. How about coffee and alcohol? Can you give me one of those? Can you get rid of one of those for me?
I don't know. I might cut back, but I'm not giving up either.
How about we try to, do you find yourself vaping more when you drink?
Yeah.
All right, so why don't we try to cut back on the alcohol for a couple weeks till we have a follow-up appointment? Just cut back and see if it helps.
Well, I'll try.
Okay. Well, that sounds good. What about your chips before bed?
Well, you want to give up everything.
Well, do you notice that the nights that you have your chips when you go to bed, is the reflux worse in the morning?
Yeah, well, not in the morning. Sometimes I wake up and I'm coughing and it's like it's came back up and I breathed it in.
What's it feel like here in your chest? Or do you feel anything in your chest?
Burning, and it's like I can't get it up.
Okay. All right, so that brings us to signs and symptoms. So one of the big ones is pain. So you definitely have pain, you think?
Yeah.
How bad would you rate your pain on a 0 to 10 scale, with 10 being the worst possible pain you've ever felt?
Oh, 4.
4. A lot of people say it feels like they're having a heart attack. Have you ever felt like that?
Sometimes, yes.
All right. What about nausea?
Sometimes.
Okay. Halitosis, which is bad breath.
No, not
Anybody
usually.
ever tell you you have stinky breath?
No.
Good. Dysphagia, that's difficulty swallowing. Do you have any trouble swallowing?
No.
All right. What about dyspnea, which is difficulty breathing? Do you find yourself coughing and Trying to catch your breath a lot at night?
Just when I eat those chips.
Oh, see? How about vomiting?
Sometimes.
Okay.
Yeah.
What about tooth enamel? Have you been to the dentist and they tell you that your tooth enamel is eroding or anything?
No.
Very good. What about a lump in your throat?
No.
Sometimes it feels like the patients describe it as like they have to throw up, but nothing comes up. It's just sits right here.
Yes, not often.
Okay. Those are symptoms that are not specific to any time of day. They can happen at any given time. There are some things that are more prone to happen at night with nighttime reflux, which is lingering cough, which is, I'd say that's what's going on with you this morning. Laryngitis. You ever notice any of that?
No.
Okay. What about sudden onset or worsening of asthma?
No.
Okay. How about difficulty sleeping?
Well, those nights that I ate my chips.
The chips are going to do it. How about we just talk about giving up the chips at night? Do you think that that's something that you could do?
Well, maybe I could eat them before I lay down.
Maybe an hour and a half or so before you go to bed?
Okay, yeah, I might.
Or at least remain upright for a while.
Yeah, I could probably do that.
But it's still going to cause it a little bit, but maybe that would slow it down just a little bit. You see this lady here, you ever find yourself grasping your chest?
Yes.
She's drinking
coffee.
coffee.
Oh my GERD.
Oh my GERD, that's what everybody
so
says.
bad.
How
Yes.
about she's drinking coffee?
Yeah.
So, that's
I
something.
could probably give up my coffee before I give up my White Claw.
I understand. So, the complications of untreated GERD, you can have an esophageal ulcer, which is a growth in there, or an esophageal stricture, or even Barrett's esophagus, which is, any of those three things. I don't think that's a road that you want to go down. It's much easier to get this taken care of at the stage that you're at versus leaving it untreated and not doing those modifiable things that you can do to feel better. All right, so as far as treatment, there's diet and lifestyle changes, which we talked about, and you're going to cut back a little bit on the chips
I am.
and stay upright. Medication, which doctor has prescribed for you, he wants you to take a Meprazole, and it's 1 tab once a day in the morning. First thing in the morning, get your day started off right with that. You can buy these at Walmart or Kroger or CVS, anywhere. Sometimes they even have flavored ones that don't taste so bad going down. Okay? And, if this doesn't fix it, there's always procedural and surgical interventions that we can look at, but that's not something we want to go to yet.
Okay.
All right. Do you have any questions or anything for me?
Yeah, if I start taking the medication and then, like, it has a flare up or something, is there anything that I could eat or drink or take, like if it's acting up then?
Milk helps a lot of patients, and so does acid reducers like Tums. But you don't want to take a whole lot of those because that'll increase your risk for fracture. And I know you're getting a little bit older, and that's not things that we want to talk about, but that's stuff we got to worry about.
Okay.
But sometimes a good cold glass of milk will help.
Okay.
That's a good place to start.
Okay.
All right. Well, sweetie, I made you this brochure here. It's got everything that we've talked about is on there. If you have any questions, feel free to call me. My number's on there. And there's some good websites to reference there. Okay. And before you go, let me give you this little demonstration. Okay. For our purposes, this red bulb is going to be your stomach.
Yes.
And this is your esophagus.
Okay.
And right here, this black part, that's that muscle ring I was talking about that goes around. So let's say you've just ingested some food and it's all sitting down here in your stomach. Your chips. Let's say we had your chips. So they're sitting in your stomach. You lay down. Okay. And the chips are down here. Everybody has acid in their stomach naturally. So those chips are turning around in here with that acid. Well, that muscle is weakened. And it opens up a little bit. And look what comes up into your esophagus.
Oh, I see. And so that's what's
the
causing
acid.
the burning up in my throat.
That acid goes up. And if that's your throat right there, once in a while, it'll whoop over just like that.
Gotcha.
All right. So that's why it's important to do the things that we talked about.
Well, that really helped having a visual.
I'm glad. Well, if you have any questions, let us know. And make sure you go pick up that omeprazole, okay?
Okay.
All right. You have a good day.
Thank you.
Thank you.